There is a common agonist effect also that might cause confusion, so there should be an initial. There could be an initial competency. So, through this, on the receptor, anxiolysis happens because this binds to the alpha-2 receptor, the drug, and so norepinephrine is not released. So again, the same. There is another receptor, imidazole receptor that dexmedetomidine acts with, and that's probably the hypertension, bradycardia, and cardiovascular effects on this. The other system we already discussed, cyclic increase. There is a calcium channel is blocked, and inward rectifying potassium channel causes lots of potassium goes out and causing hyperpolarization here. This all results in cooperative sedation and anxiolysis, decongestion, anticellular effect, analgesia, hypertension, bradycardia, reduced bowel mortality, and diuretic effects. So renal function is actually improved, especially in cardiac patients. Respiratory effects is most melodic part because despite the good sedation, despite the reasonable calculated sedation, there is minimal respiratory capacity effect. So most data suggest that the saturation and carbon dioxide partial pressure does not change, and numerous reports during spontaneous ventilation says that there is no change in carbon dioxide levels. Now, rapid distribution, as we said, 6 minutes में redistribution half-life है उसकी, और eliminate हो जाती है within 2 hours. So within 10 minutes patient would be awake. When you switch it off, within 10 minutes patient would be awake. So protein binding, biotransform in the liver, interactive metabolites excreted in urine, increases inactive. No accumulation after infusions, 12 to 14 hours of infusions, pharmacokinetics similar in young patients and elderly. Even in the children, pharmacokinetics remains the same, just because there is no active metabolite that accumulates in the body. मिलता कैसे 2 mils ampule 100 microgram per ml, उसको आप dilute करते हैं 40 ml, right, 50 cc syringe पे, make a in the syringe pump. Loading dose is 0.5 microgram to 1 microgram per kg, and that is given over 10 minutes. Maintenance dose is 0.2 to 0.7 microgram per kg per hour, which is around 4 to 9 mils an hour. And the dose is titrated by 0.1 microgram per kg per hour, which is the low dose that we have come करना हो ज़्यादा करना हो, and within 10 minutes there is a complete recovery. Now a few studies that we I just wanted to show you. Dexmedetomidine. ये एक study है. There are two randomized controlled trials. इसमें it is compared with midazolam of propofol population with prolonged mechanical ventilation. Because there was a concern that dexmedetomidine cannot be used for prolonged purposes. Just for only for 12 hours, 24 hours. So these are two RCTs, 2007 to 2010. 44 ICUs participated in 9 European countries. They concluded that it is not inferior to propofol and midazolam in maintaining the target sedation level in broad spectrum of ICU patient requiring prolonged mechanical ventilation. इसके लिए उनका recommended नहीं है. Dex appeared to reduce the duration of mechanical ventilation as compared with midazolam, reduce the time to extubation as compared with both midazolam and propofol, reduce delirium as compared with propofol, and was associated with improved patient communication with nursing staff. Had specific side effects, which are known side effects, bradycardia and hypertension that can be managed easily. Now, when compared with remifentanil for the post-operative pain control after a spinal surgery, one study is that obviously the comparative drug amongst the opiate group is remifentanil, which is again short-acting drug and given in infusion for the ICU sedation and analgesia. So that is the drug which actually is a competitive drug with dexmedetomidine. So they randomized control trial. 40 patients scheduled for posterior lumbar interbody fusion surgery under GA. They were enrolled. Anesthesia was maintained using propofol at 3 to 12 milligram per kg per hour, and remifentanil with 0.02 to 0.2 microgram per kg per minute in remifentanil group, or dexmedetomidine 0.01 to 0.02 microgram per kg per minute in dex group, keeping the bispectral index between 40 and 60. Dex group displayed superior efficacy in alleviating pain in post-operative pain management for 48 hours after BLIF. Therefore, Dex may be used instead of Remi as an adjuvant propofol-based TIVA. So this is they concluded after this RCT. Anesthesia, we can use it in anesthesia of in wide spectrum. Starting right from the pre-medication, it is anxiolytic, it is sedative, it is sympatholytic, and it is anticellular. So all these things that we need as a pre-medication. So it can be used as a pre-medication drug. Perioperatively, it can use if we start off immediately. This can be used for obtaining the intubation responses. Opioid sparing effect is there. Sympatholysis actually reduces incidence of post-operative MI mortality in a group of patients where we have these cardiac patients for non-cardiac surgery. So, cardiac anesthesia, it is one of the most favorite drugs. It is becoming one of the most favorite drugs for the cardiac anesthesiologist. You can provide obviously continuous sedation throughout, hemodynamic response to intubation. It has successfully used to manage patients with pulmonary hypertension undergoing mitral valve replacement with the reduction in pulmonary vascular resistance, mean pulmonary artery pressure, and pulmonary capillary wedge pressure. So, which is a very important group, especially in our population where mitral valve replacement, and we all know that what stage these patients come to us, they all have got pulmonary hypertension, almost the severe mitral stenosis. So this could be a very good help if it actually reduces the pulmonary hypertension, and I would suggest that we could conduct a small little study also on this with the using the drug in the to see what change in pulmonary hypertension does. So this is one of the studies here. Dexmedetomidine, clinical application of dexmedetomidine. It reduces myocardial damage in off-pump CABG. This claims one of these studies here. Dexmedetomidine attenuates myocardial injury in off-pump bypassology, a Journal of Cardiothoracic Vascular Anesthesia in 2016. Coming to the next cardioprotective effect after cardiac surgery. Dex has several complex physiological effects on the heart. Firstly, there is a direct dose-dependent cardioprotective effect on reperfusion. Additionally, when given at high doses, it has favorable subendocardial or subepicardial blood flow ratio, providing better functional recovery from myocardial stenting. This is claimed in this one of the studies in the journal Shock 2012. Now, as far as delirium is concerned, this we all know it's a common thing, especially in the elderly after the cardiac surgery in the ICU. And it has anti-inflammatory properties, decreases use of opiates and benzodiazepines that contribute to delirium, and provides sedation very similar to the natural sleep that can attenuate delirium seen after cardiac surgery. So this is the study in the Critical Care Journal 2016. Chronic post-cardiac surgery pain can even be attenuated. The incidence of post-thoracotomy pain syndrome in the Dex group was 22% as compared to 52% in the control group. In one of the studies, again published in Anesthesia Pain Medicine 2016 by a group of researchers. Renal function of the cardiac surgery after cardiac surgery. Another RCT of 200 patients, 100 treatment versus 100 placebo, undergoing valvular heart surgery. Those who received perioperative Dex infusion had a lower incidence of acute kidney injury versus placebo, 21% versus 38%, and shorter length of ICU stay. Several small clinical studies have investigated the renal protective role of Dex after cardiac surgery. So these are the two references, both 2016 and 2017 journals. rather recent. Coming to neuro anesthesia, this was about the cardiac anesthesia. In the neuro anesthesia also, it is a very useful drug to be used when perioperative cooperation of the patient is required, especially. It has got a neuroprotective effect in hypoxic, ischemic and traumatic brain injury models. This effect appears to be afforded by the action of the drug on alpha-2 receptors and etimidazoline receptors. There is no effect on intracranial pressure, no effect on somatosensory evoked potentials or motor effects. So may be useful anesthetic sparing agent and analgesic supplement scoliosis. This is published in British Journal of Anesthesia 2016. Procedural sedation, it is used, can be used in small procedures like classes which are echocardiography, uncooperative patients, colonoscopy, awake carotid endarterectomy, shock wave lithotripsy, pediatric patients undergoing tonsillectomy, burn dressings, urology procedures, gynecology small procedures. So these are all procedures where Dexmedetomidine can be used. There were few enthusiasts who used it as a single agent for general anesthesia. And there are two case reports. These patients required doses of 5 to 10 microgram per kg per hour, 5 to 10 times the maximum recommended dose for the procedural sedation to be adequately anesthetized. The authors chose this technique in two of the cases due to the nature of the surgery. One was the laser ablation of a tracheal stenosis and a tracheal debridement and bronchoscopy lavage. Dexmedetomidine allowed preservation of respiratory drive with easy maintenance of a patient airway. One patient required a chin lift only. There was no hemodynamic compromise in this small group of two patients. This is where BJ Education 2016, this was published, this study. So, post-operative, obviously, anesthesia, sedation, continued infusion at the time of extubation can give you an emergence smoothing effect in few patients. So, invasive procedures, awake fiber optic intubation के लिए आप यूज कर सकते हैं, सेंट्रोवेनस कैनुलेशन in children, uncooperative patients, when lines डालनी है, IABP insertion in the ICUs, cath procedures, any invasive procedure in a very anxious and cooperative patients, actually you can use Dexmedetomidine because of its safety profile that it has. Non-invasive procedure में रेडियोलॉजी suites में जितने भी cases होते हैं उन सब में आप यूज कर सकते हैं, especially in obstetric sleep apnea बहुत ज़्यादा मोटे patients हैं, mediastinal mass वाले patients हैं जिनमें respiratory pressure पे ज़्यादा risk है, you can use sedation with the Jackson treatment. Regional anesthesia activates mixing with local anesthetic actually prolongs its effects. And conscious sedation can also be used with the neuroaxial block. आपने block लगाया है थोड़ा सा sedate करके रखे patient को, so that can also be a good use of the drug. So in the monitor anesthesia care, baseline sedative for a broad range of surgical procedures gives you better patient cooperation, less opioid requirements, less respiratory pressure than and fentanyl. So intra-articular anesthesia के लिए भी यूज हो रहा है, intravenous regional anesthesia के लिए भी यूज करना लोगों ने शुरू कर दिया है. So it is there is some good thing that can come out of something which you think is bad. We got it late, but the good thing is that we have so many studies to see the profile and see the exact effects of the drug. So it is now as a non-anesthetic use, people are using it for the withdrawal, opioid and benzodiazepine withdrawal, alcohol withdrawal, sedatives in sleep deprived patients, anti-shivering agent के तौर पे यूज कर. So what are the main advantages of this drug? It is like one drug, 3-in-1 drug, I would say. Sedative, analgesic, and curative, and with no respiratory depression. That's the plus. Short pre-distribution half-life is big plus, 5 to 6 minutes only, gives control on degree of sleep at time of arousal. Elimination half-life only 2 hours. Non-cumulative, that's a good thing. On non-dependent on the age, elderly may, young may, बच्चों में almost एक ही elimination half-life. Negligible drug interactions except additive and synergistic effects with the other sedative. वो जो साइटोक्रोम 450 वाले जो इंटरेक्शंस होते हैं उस सारे एल्यूमिनियम ऑक्साइडेज इनहिबिटर्स वगैरह के साथ जो होते हैं उस तरह के इनके ड्रग इंटरेक्शंस नहीं है दैट्स गुड थिंग अबाउट इट सो एंड देयर इज नो रिस्क ऑफ डिपेंडेंस ऑन द ड्रग जो कि सारी ओपियोइड्स में होता है सो few cautions dose reduction and cautious titration is recommended in hepatic disease, basically possibly renal disease as well, elderly patient, uncontrolled diabetics. Uncontrolled diabetics are probably more prone to develop hypertension because of their autonomic instability. It is contraindicated, not absolutely but relatively definitely. Uncontrolled hypertension, heart block, second and third degree heart block. Third degree heart block, especially because it causes bradycardia. But if you have got the pacemaker in the ICU, obviously you can manage that effect. So coming to the end of the presentation, says I would say Dexmedetomidine is a very valuable addition in the armamentarium of anesthesiologists and intensivists here. It has got excellent profile for use as a sedative, analgesic, anxiolytic drug with even anti-inflammatory properties that come handy for chronic post-surgical pain management, especially after Part B and Precidex in cardiac cases. Its special cardioprotective effect makes it an ideal sedative to be used by cardiac anesthesiologists. Its short half-life and quick onset of action gives the precise control over sedation. ICU agitation and delirium can be safely managed. ICU sedation and agitation scales can be monitored and maintained with such quick-acting drugs available for use. Other could be remifentanil. There are trials with remifentanil and dexmedetomidine are used combined in patients, so that you get the maximum additive effect and and avoid the side effects of both. All in all, it's a great drug to be used with the hope of improved ICU care of our patient. And we thank you all for the listening, and we thank to Brooks also for bringing this good drug to us, to our armamentarium, and hopefully it will remain available and at a reasonable cost as well. Thank you so much.